Good afternoon. My name is Chrissy Matheson, and I'll be your moderator for today's press briefing. Before we begin, I'd like to introduce the Premier of Nova Scotia, Stephen McNeil, and Nova Scotia's Chief Medical Officer of Health, Dr. Robert Strang. Premier.
Thank you, Chrissy, and good afternoon, everyone. Before I turn it over to Dr. Strang, we are announcing 4 more deaths at Northwood. I want to tell you, this is by far the most difficult part of the conversations that we have with Nova Scotians. Losing a loved one at any time is extremely difficult, but losing it at this moment in time with COVID, but also with the restrictions on the way we can get together and mourn.
In their Halifax campus has 25 cases and 15 staff that are considered active. There is one other facility with a single staff member and a third facility with a single resident who are considered active cases. While things are encouraging, it's very important that we continue to be very vigilant and look and detect any cases of COVID-19 that are around. It's important, and I'll say once again, anybody who is feeling unwell and has 2 or more of fever, new or worsening cough, sore throat, runny nose, or headache, there is a possibility that these could be related to COVID-19, and it's important that if you meet those criteria, that as quickly as you can, you contact 811, either online if possible, or if that's not possible, calling them to seek a further assessment, and they'll direct you for testing as necessary. Premier.
Thank you, Dr. Strang. Another long weekend is upon us, and I know a lot of you need a break from being cooped up and shut in. 2 weeks ago, we lifted some restrictions to get you outside. We did that with the understanding that you would follow the public health guidelines and protocols, and you did. Our case numbers have been going down, and Dr. Strang and I thank you for cooperating and respecting the rules and each other. But we know that you need a little more, and that's why we're lifting a few more restrictions to get you outside for some fun. But there is one restriction we are announcing that we know is hugely important to all of you. You've reached out by phone, email, and some of you have been asking during this stream, when can I see my family? Today we are introducing an immediate family bubble. That means 2 immediate family households can come together. You will have to figure out who, and you will have to promise that you will be mutually exclusive. We want to reconnect families, but we can't put anyone at risk. We need you to do it safely. So, for example, if you're an essential service worker surrounded by others at work and you have older parents who have been isolating, you might not be the right choice to be their immediate family bubble. You will have to keep visiting virtually or waving from the end of the driveway for a little longer. But if you have a sibling who has been isolating at home, they can be your parents' immediate family bubble. You cannot do this with more than one household, and you cannot take visitors. Now, Dr. Strang will give you more details about this and other restrictions that we are lifting.
As we continue in our consultations and work on the reopening plan, and as the Premier has just said, I want to talk a little bit more about loosening more restrictions, allowing Nova Scotians to have more social connections. And I think the social connections is really important. We are, after all social creatures. There's growing science around the health impacts of isolation. And I think that maybe there's a good argument to be made that Nova Scotians are more social creatures than many other people in other parts of the country and the world. Connecting with family and friends is critically important for our collective mental health and for sustaining a positive sense of community. For almost 2 months, we've asked you to stay at home, away from family and friends unless it was essential. I know how hard that has been for everybody, but despite that, people have listened, and I thank you for that. For the last week, we have seen low case numbers. Our collective actions are flattening the curve. That's why in discussions with the Premier, we feel it's the right time to talk about more opportunities for social connection, but doing that carefully and safely. The Premier has described the immediate family bubble. This could mean parents, siblings, grandparents, whomever you consider your immediate family choice to be. It's up to you to define that. One household can have a close connection with one other household who is part of what they determine their immediate family. It's important that people understand that this does not mean that families can get together in large groups for barbecues and reunions. What we're announcing and is a very first step in allowing immediate families to gather in small groups. We're asking you and we're needing you to take it slow and make informed and wise choices. Before you have a close contact with family, we need you to consider three main things: age, occupation, and health condition. Think through these important questions. Is anyone at higher risk of severe disease from COVID-19 infection? If people are 65 or older, especially if they have underlying health conditions, or if there are people regardless of age with significant chronic disease or are immune compromised, those people need to be much more careful about who they connect to. We also have to think about, does anybody have frequent contact with the general public or part of their job, or for some other reason maybe at higher risk of being exposed to COVID-19? Again, though, you need to be especially careful about who those people connect with. And it's critically important that even though you may make a choice and start to connect as a family, if anyone in either of those family bubbles are sick or showing symptoms, then there should not be visiting between those households until that individual is either better or has been, if necessary, has gone and got tested and been cleared of having COVID-19. I'll give a couple of examples. If your grandfather has chronic obstructive lung disease, COPD, consider not having close contact with him, as hard as that may be. He's more vulnerable to severe illness. If your sister is a healthcare worker, especially if somebody who's in frontline healthcare worker in possible contact with COVID-19 patients, you may want to consider social distancing in case she has had contact with the virus and may spread it. We don't want to put anyone at increased risk or create conditions where the virus can easily come back and spread. If that happens, we can find ourselves back at square one. I know this is not a one-size-fits-all approach. Some of you may not have immediate family who live in Nova Scotia. Some people, unfortunately, are estranged from their immediate family. But I want people to recognize that even though this doesn't fit for everybody necessarily, this is a first step towards opening up our social networks in a measured way. I also want to talk about opening up outdoor activities to allow all of us to get out and be more active as the weather gets nicer. We have black flies at our friends that we want to go and meet again this year. As of today, beaches are open for walks. Paddling, surfing, and other activities can also resume. We want to get people outdoors to be active and do it but do it at a safe distance of 6 feet. We have worked with Sport Nova Scotia to identify activities that can be done individually or in small groups. Archery, equestrian events, golf, paddling, sailing, and tennis. Each of the provincial organizations responsible for these outdoor activities have presented solid plans to reopen their outdoor facilities and activities safely. They can open beginning tomorrow morning, or if they need more time, as soon as they're ready. So I would check with each of those individual sports and those facilities before you go make plans. I have worked closely with Sport Nova Scotia. I've reviewed and approved the activity-specific plans for each of these 6 organizations. And I've reviewed them to make sure that they're adhering to the necessary public health requirements, that participants have to keep physical distance, that they are allowed to have washrooms and change rooms open, but maintaining physical distance and appropriate numbers within these facilities need to be followed. They have enhanced protocols for cleaning and disinfecting, and they clearly have protocols to make sure that people are advised that if they're feeling unwell, they are not to come and participate. This is for outdoor activity opportunities that people choose to do any of these 6 sports. We are still not allowing organized coaching or training, competitions, tournaments, regattas, and so on. As I said earlier, there are many other options for outdoor physical activity around the province. And one of those is just recreational boating. And I want to clarify, there's been some thinking that we've actually closed recreational boating down. We never have. So it's important that Nova Scotians know that it's okay to go to wherever your boat may be, whether it's a sailboat, a yacht, a motorboat, that you can go out for sailing as long as you follow the public health requirements. At the facility where your boat may be docked or moored, you got to maintain social distancing. That who gets to go on the boat, those are people within your household or your immediate household bubble. So recreational boating is an opportunity as well. I also have some news about the fire ban, which I know that there's been a lot of interest in about where the status of that. We still have a ban on province-wide open fires until June 1st. However, Nova Scotians can now have a fire in their backyards if they are using an appropriate appliance like a fire pit. You can only sit around your fire, however, with your household or the household in your immediate family bubble. This is another way to get out and enjoy the outdoors. And speaking of my friends, the blackflies, sitting around the fire is a good way to keep them away. So in closing, our actions now, our collective actions, even this weekend, will determine how quickly we can reopen other things in the weeks and months to come. I do hope that this news will be seen as a positive that will help ease some of the pressures and stress that people have been under. I know that there are some people who want to go further, but we have to be slow and cautious here. It's important that people understand that this is not a free-for-all. We have to open things up in a gradual, careful, limited way. We're continuing to monitor the situation closely, and we're looking at the epidemiology. And I have to let people know that if we start to see more virus activity, we may well have to pull back and restrict these activities again. At the end of the day, this is all about individuals' choices. And if people, if for whatever reason they want to continue to isolate or be very restrictive on their exposure, that is absolutely a reasonable and a personal choice, and people should feel comfortable making that choice. All of you Nova Scotians have been with us collectively so far. We're asking you all to just to stay together for a little while longer and follow the rules. COVID-19 is still here. We have good signs, but it's still a risk. However, there is definitely light at the tunnel. So I just want to end by wishing everybody a fun, long weekend, but please do that safely. Premier.
Thank you, Dr. Strang, and we'll now be happy to take any questions, Chrissy.
A reminder that there will be one question and one follow-up per reporter in the amount of time that we have today. First question will go to Mike Gorman with CBC.
Thank you. Dr. Strang, could you talk a little bit, please, about how you came to start with the eased restrictions that you did today, and I guess how you balance that with the concern of what you might have to do if you see caseloads jump back up? And I'm wondering also, for a point of clarity, you mentioned in your remarks that beaches open today. However, the news release that's gone out says they open tomorrow. So I'm just hoping you could also clarify that point.
So the beaches are closed under the emergency order. In the discussions we had this morning, that the emergency order was in effect as we're making this announcement. The other outdoor activities, they are open effective tomorrow. Technically midnight of today, but starting tomorrow morning. So as you looked at, the rationale, we started 2 weeks ago with slowly opening up the outdoors with parks, with trails, other things, knowing that we needed to give people, for their mental health, an ability to start to get out. For about 6 or 7 weeks, we'd saying, stay home. And we needed, for obvious reasons with COVID, but where COVID was at, but also some of the terrible events that had happened in Nova Scotia, we needed to give people a way to get outside, to connect with each other from a distance, but also just enjoy the outdoors for mental health purposes. We've continued that, the opening up the number of activities based on the fact that in my discussions with Sport Nova Scotia and these kind of outdoor activities which already exist, that they all had very good plans that they could be resumed, but do that in a way that respects the public health requirements to protect public safety and public health. So that's where we said the decision on those specific activities, because they're able to do so in a way that is safe, given where we're at in the early stages of the end of wave 1 of COVID. The concept around two households, immediate families connecting with each other, was a decision based on, again, the importance of, as I said in my remarks, the social connection with each other. We can't minimize the importance of that and the challenges that many people have faced for the last 8 or more weeks about being isolated. But we also need to open that door, if you will, very carefully. So starting with two households that we're saying immediate households, and people get to define what that is, but it has to be done carefully. So it's two households that can get together, and if they're getting together, they can't get together with anybody else. So it's a step in the direction of increasing social connectedness in a way that because of the numbers are small, that even if there is somebody infected there, that the ability for the virus to spread widely from these small household bubbles getting together is very limited. So certainly from a public health perspective, it's a very safe way to start to open the door of increasing the ability for social connection.
Mike, do you have a follow-up?
Yeah, thank you. I know we're a few weeks away from this still, but I also wanted to ask you both about daycare. Dr. Strang, I wonder if you have seen anything in the last couple of days in other parts of the country that is causing you to revisit at all the thought that daycares could open in early June, and by extension of that, why looking at daycares versus everywhere else where gathering limits are still quite low, do you think that's a safe approach to use? And Premier, I wonder if the province is looking at any potential extensions of daycare services for school-age kids, given how many camps and clinics appear to have been canceled this summer.
So from a public health perspective, there's a few things that we need to understand about daycares. The evidence is growing that actually the children, and especially young children, are not, for whatever reason, they don't transmit this virus easily. So there's a growing comfort from a public health perspective that their relative safety with this age group, and therefore makes it easier to justify how you bring them together. Clearly, I've had an initial conversation with the licensed daycare sector. They're fully aware of the public health parameters which they need to operate. So we're waiting to get their plans back, and we'll be carefully reviewing those plans. Like every other plan that'll come in, is finding a balance between the appropriate levels of protecting health and safety related to COVID-19, but also allowing them to operate. And it won't be daycare as we've saw it, back before COVID-19. It'll be daycare in a different and in all likelihood a more limited way. But we also have to understand that as we open up the economy and more people getting back to work, childcare is a critically important part of that. So the two go hand in hand, but working very closely with childcare, the licensed daycare sector, to make sure we're doing that safely. There has been one outbreak in a daycare in Quebec, and in my national calls where we have repeatedly asked, and Quebec is doing a thorough analysis of that. Once they have been able to do that, that'll be brought back to the national table. But as other jurisdictions are, even in Canada, are opening up daycares, it's the Quebec example stands as in an isolated event. So we have to. There's nothing that indicates as we're opening up that daycares are a significant contributor to a resurgence of COVID-19, at least at this point.
Thank you, Mike, for the question. You've highlighted the importance of why we've taken a different path than most Canadian provinces, many of whom, and people in this province, have been screaming for dates while we've been actually focused on using public health to reach out to the associations, organizations that are responsible for large parts of our economy and indeed daycares. You know, we announced that almost 2 weeks ago. We've been working with them so that when June 8th arrives, they will have a plan that has been approved by public health. It's why we're reaching out to the restaurant associations and giving them a plan that they can start preparing their businesses and other organizations, cosmetology and others, so that when we actually get comfortable to open up our economy, the rules will be in place. Many other provinces have chosen to pick dates, announce them, and then if those businesses and other places have had to try to figure out how to open up, we've chosen a different path. And I know it's frustrating for some who think we should be following the lead of every other province by giving out dates. Our focus has been on trying to do this right, safely, and one that allows us, when we do open, it's one that will be sustainable in the long run. And as far as your question around camps, Dr. Strang, in making some of these announcements today, has been working with Sport Nova Scotia, and part of that has been as well as what do we do around youth sports, youth activities, camps that may not that typically go on during our summer in our province. We may not be able to see the kind of level of competition this province is known for nationally, but maybe there's other ways that we can have activities that we can engage with our kids in local communities across the province, and that's part of the ongoing conversation, and we'll have more to say in the coming weeks about how do we keep our children active in this will be a unique summer for them.
Next question will go to CTV's Natasha Pace.
Thank you. I'm just wondering, we talked earlier this week about lifting restrictions, and there were 4 deaths at Northwood today. So why is today the day, I guess, to choose to start to lift some of these restrictions?
So I think we have to understand that when we look at the epidemiology, Northwood is a unique event. And that when we're looking at a recovery plan, what we actually need to do is take all the Northwood epidemiology and set it aside and look at the epidemiology of cases that are occurring outside of Northwood. And we're actively doing that, and what we're seeing over the last couple of weeks is a decreasing and a sustained low level of cases, COVID-19 cases related to exposure out in the community. And don't mean at all to diminish the importance, and we continue to work very closely with Northwood, but we have to look at that from a decision-making perspective, from setting that aside and not let that, that gives a false impression of what actually the community activity around COVID-19 is.
Natasha, do you have a follow-up?
Yes, I do. Thank you. Dr. Strang, I'm also wondering, I've heard from a few people who have concerns who have home care in their home, and they're concerned that the worker is also working at Northwood. Is there anything you can say to explain or, I guess, reassure folks that there would be no community spread in that particular case?
So I'm not sure I'm understanding the exact question, the intent of your question around, is it somebody working in Northwood who then goes back into a home where there's a home daycare operating?
No, sorry, home care. So from my understanding, the individuals have home workers come in for home care, and they're concerned that they may be also working in Northwood.
So we have set up a requirement that any healthcare workers who, whether it's coming from IWK, the health authority, or for any of the long-term care or home care sectors who are then, and we thank them for this, were willing to come and then work in Northwood, they have to go through a 14-day home isolation period before they can go back to work, whether it's in a home care environment or back in the hospital. And that 14 days is a recognition of the extreme circumstances at Northwood that is the possibility that anybody working there could be exposed, and then so before they go back and work in another healthcare environment, they have to have that 14 days to ensure that they are not infected with COVID.
Next question will go to Alicia Draus with Global.
Thank you. I'm just wondering a little bit about the family bubble. I mean, when 2 families join, this will mean that there will be some groups larger than 5. And so I'm just wondering if these 2 family bubbles are allowed out in public and how that kind of affects the gathering group limit.
So we haven't put restrictions on that, and in fact, it's better that they get together in an outdoor environment than an indoor environment. So yes, they could go out. As I said, I use the example of boating. That if one of the families has a boat and they want to go on recreational boating, they can go now. 2 households, if they are creating an immediate household unit, they can go out and do the social activities outdoors or the recreational activities outdoors, and don't have to follow that 6 feet social distancing, but other than having to stay apart from other groups from 6 feet. But we're asking people, people as they make choices about making these immediate family connections, that also want, that it's making some common sense connections. So if they're big households, then being very careful about what numbers that actually get together at any given time. That's all part of the common sense and making some risk choices about who they decide to get together with and under what circumstances.
Alicia, do you have a follow-up?
I do. I'm just wondering, I know one of the things that still hasn't been on the list of easing restrictions is campgrounds as another outdoor activity. And so I'm just wondering if there's any indication of when we might see camping open up a little bit more.
So I had a very good discussion with the Private Campground Association earlier this week. We're working together on plans, but they've indicated that they still need a couple of weeks to be prepared. So we continue to work with them. I also know that our public campgrounds and through our provincial parks I've seen an initial plan that they have as well. So we're very much working actively to look to how do we open campgrounds, whether it's private or public, in a safe manner in the near future.
Next question will go to Canadian Press's Michael Tutton.
Hello, Dr. Strang. Some weeks ago, in mid-April, before the deaths of Northwood, Janet Sims said to me that she felt that contact tracing would tell the tale that shared rooms was a key part of the transmission of COVID-19 in Northwood. Can you confirm that she was correct, and that in fact that shared room and spread through shared rooms has proven through testing to be a key means of transmission? And if so, what are the plans to going forward to avoid having people sharing rooms?
So I'll take a first attempt and maybe turn to the Premier. I haven't gone case by case and looked at it in detail, but we clearly know that and this is not, I'm not speaking specifically to Northwood. There's a national conversation about our home care infrastructure, clearly knowing that shared rooms increase the likelihood of transmission of whether it's COVID-19, influenza, other infections. So, and that's why the standard now is building new long-term care facilities is to not to have shared rooms, but we need to have the ability to have transition over time to that new standard.
Michael, do you have a follow-up?
Well, Premier, on just a related matter, one of the other difficulty our province is struggling with now is, of course, the mass shooting. 33 of 40 law professors are suggesting your government should initiate a public inquiry, and it should be through a Provincial Fatalities Act, the Provincial Public Inquiries Act, and that it should be the province that initiates it. Have your thoughts changed at all on that? What's your response to that?
Well, we can only call an inquiry to matters that constitutionally fall under the responsibility of the province of Nova Scotia. While we had the responsibility for policing, it is clear that the RCMP fall under the federal government. They are governed by it. Constitutionally, they are the responsibility of the national government, as well as the firearms as well fall under the Constitution of the national government. With all due respect to the law professors, we believe the people, the federal government, who has the constitutional responsibility for both of these entities and others potentially associated with this mass shooting in our province, should be the one who would call for whatever they determine for review, whether it's commission or an inquiry, on a go-forward basis. What I've clearly said, and our Attorney General has said many times to all of you, is that we would certainly support that, but the lead agency and the constitutional responsibility falls with the national government.
Next question will go to Lindsay Armstrong with All Nova Scotia.
Thank you. For the Premier, you said a phased plan to further lift restrictions is under development. Can you help Nova Scotians understand why another set of restrictions has been lifted without a clear plan for reopening? And will Nova Scotians know about the phased plan before the next restrictions are lifted?
Well, clearly, what Dr. Strang has said a number of times in his remarks today, there is ongoing work. Every restriction that was lifted today was those associations actually have gone and done the due diligence on how they can operate within the public health protocols. That's why we've continued as a government working with public health to reach out to all of the organizations that are representing big parts of our economy, and how do we ensure that they present us with a plan, or present public health with a plan that reflects their ability to fall within the public health protocols, to ensure that when we do open, their customers feel safe, their employees feel safe, so that we can then enjoy those particular businesses. Others have chosen a different path. You may have heard that daycares are opening right away in New Brunswick, and yet daycare operators don't know how to do that. We wanted to make sure that when we say we're open, people understand the rules that associated with that, and they'll be ready to open. We've seen other aspects across our economy where organizations across the country, where governments have said you can open, and those organizations don't know how to do that within the public health protocols. What we have chosen to do is what we believe is a prudent path to working with our associations, whether it's the Restaurant Association, the Cosmetology, as I said earlier, and working with public health to say, give us your plan on how you think you can operate your business within the rules of public health, and they will be reviewed. And when we continue to see that curve flattening, and when we open the economy, those businesses will be ready to go, and those parts of our economy will be ready to go on day one.
Lindsay, do you have a follow-up?
Yes, thank you. The news today comes about 2 weeks after the last set of restrictions were lifted. Is this about the rate that Nova Scotians should expect, the new sets of these restrictions, and will we get the plan before that happens?
I don't know. I'm not sure that I would hold firm to the 2 weeks. Dr. Strang has been very clear about the fact these cycles are 28 days. It's been 28. It'll be 28 days at the end of this 2 week cycle that we've gone through this process. But I should be clear about this, and those that are looking for a 5-point plan on when this is going to open or that's going to open are following what other provinces are doing. They should actually follow what Nova Scotia has laid out, which is a very clear plan. You need to be able to tell public health you can operate safely, that when you want to open your business, you can do it. We've chosen, instead of dealing with every restaurant, we deal with the Restaurant Association. We've laid out a plan to them. Now it's up to them to figure out whether their business model fits into the public health protocols. We've done that with all of our organizations, so that when we decide we're going to open, a good chunk of our economy may open at once, knowing the public health protocols. And we'll continue to do that. And then as we further go through opening up our economy, what may change is the number of people who are allowed in a particular business or the size of our gatherings. But I want to be clear for those in the private sector who have been working very hard. We understand the urgency for you to open up. Continue to ask your organization that represents you to continue to work with public health. Continue to follow the protocols. Continue to get your business ready. And when we can lift the restrictions and you've met those protocols, we will work with you to continue to get your business back on sound footing.
Next question will go to Radio Canada's Olivier Lefebvre.
Merci, Premier. I hear from opposition members, citizens, they are asking how can your government be held accountable these days with number of cases of COVID going down and time going by. I'm wondering when committee meetings will start again, at least virtually, because as you know, there are legislature in the country sitting at the moment. HRM Council is having its sessions virtually, so it's possible. So why not do it?
Well, we had if you follow the House of Assembly Act in the province, Nova Scotia has 2 sittings a year, one in the spring and one in the fall. We completed our spring session back early part of March. passed our budget. It is our fifth balanced budget. Obviously, pressure on that now, but we'll continue to go forward. I've sat here every day along with Dr. Strang talking to Nova Scotians. I appreciate the fact that other parts of Canada are operating their hosts of assembly. I know the Prime Minister, who's sitting in a minority situation, needs the host of assembly to sit. I know New Brunswick is not sitting. They have an all-party committee based on a minority government situation. We're going to continue to move forward in governing the province and make sure we do it in an effective way that keeps the public health safety safe. And I couldn't be more open and transparent. Only thing short of that would be here every day as opposed to 6 or 7.
Olivier, do you have a follow-up?
Yes, sir. For the Premier again, in my question, I was talking about especially committee meetings, Public Accounts Committee, Health Committee, where there are members of the NDP, the Progressive Conservative, and your Liberal government as well.
They'll be looking at how do we open those committees up. To be perfectly honest with you, that is not on the forefront of Nova Scotians' minds. If you go back historically in our province, those committees don't sit during the summer months. They've usually broken off in early June. I get the fact that people want those committees to go. We'll look at what the fall looks like, but there is no urgency on our part to move that forward. I will work with our host leader will work with his colleagues to see what that looks like. We're probably going to have to also look like what a fall sitting would look like based on public health protocols. All of those things will be part of a conversation. But our reality and my focus is on the health and safety of Nova Scotians to ensure that we continue to follow the advice of public health. If the opposition and those in Nova Scotians have been following this, they would recognize that we're following public health. This is not a political exercise. This is not where partisanship should become involved in. This is about the health and safety of Nova Scotians, where public health should be the lead. And what I am, as the Premier of the province, get to be able to, on behalf of all Nova Scotians, use a lever of government and all the levers of government to support the efforts of public health and to ensure that our economy continues to move forward. And that's what our method has been, and that's what it'll continue to be as we go forward. And there will be, I'm sure, many reviews of the decisions that I have made or our government has made and public health has made, and everyone will get an opportunity to review those, and I look forward to that review when it comes. But right now, we're still in the midst of dealing with COVID and looking at how do we reinvigorate our economy, and that's where I will stay focused.
Next question will go to Andrew Rankin with the Chronicle Herald.
Hi. So I understand you have somewhat of a plan to open up the economy, but given that the virus has been largely contained outside of Northwood, can we expect at some point soon that these briefings will have some focus on a phased approach to reopening the economy that includes tentative timelines? Because a lot of business owners are unsure. They're very concerned about what's happening, and they're not getting much direction from the province.
We've been working very closely with the associations across the province. As I had a restaurant owner who was in touch with me, and I directed him back to his association and he got the information required. One of our goals has been here is that Dr. Strang on the public health side is reaching out to all of the governing bodies who are managing big parts of our economy and laying out to them, here are the protocols around public health, here are the things you need to do. They ask the questions, they set out a plan, and then it's up to those associations to take it to their members so that they can then see how they fit into that plan. That's a prudent path that the organization that represents those businesses communicates to them, lays out the public health protocols, works with Dr. Strang to ensure that when we do open up our economy, it's done safely, people have confidence in it, and know that the work's been done, because the last thing we want to do, as we've said here 2 or 3 times today, every time we lift a restriction, we worry about whether or not we're going to have to bring it back if those protocols aren't followed. Same thing applies, quite frankly, to open up the economy. We want to make sure that we've given businesses the appropriate public health protocols for them to follow so that we can, when we open, we can continue to stay open.
Andrew, do you have a follow-up?
Sure. So, many, small business owners are worried that they won't make rent on June 1st. So with that in mind, don't you think it's prudent that you speak directly to these business owners with a clear plan, with some sort of plan, with a timeline, so they understand what's happening and they can move further with the plan themselves?
Well, Andrew, it's important that we deal with the associations across the province. It would be impossible for Dr. Strang to speak to every entrepreneur in Nova Scotia individually. I think reasonable Nova Scotians would understand that. We've continued to lay out what the public health protocols would be. I have heard from, and I've heard from a number of people suggesting, first of all, the federal rent program, commercial landlords are not signing up for, and some who would prefer not to have the rent deferral program that we've put out there. So there's been a bit of back and forth on that. I recently, as last night, spoke to the federal government about how do we best address the issues that have been shown as a concern here in our province of somehow blending potentially those, their national program on rent and the provincial one. Is there a way to blend those to ease some of the anxiety? But I want to tell every small business owner, whether it is a small business that we shut down through the, or public health shut down through the order, or those of you that have been struggling based on the fact that we've asked Nova Scotians to stay home, opening as quickly as possible, as soon as we can, is a key priority for our government. But we want to make sure that when we do that, it's with the long-term vision in place. The last thing we could do is rush, like Andrew was suggesting, that we should rush along and do this in a hurry and then have to close you again. I know full well the cost associated with starting. We know that. We're looking at how can we best support you to do that. But we need to make sure that when you make your investment to restart, it is actually with a long-term plan and not with the potential 2 or 3 week opening and then being forced to close again. That would be the worst thing that we could do for you. And I know how difficult it is and how much how the worry that you have. But I want to reassure you it is on the forefront of our minds, and every decision that we have been making over the last 2 weeks and 3 weeks is with an eye on it. When can we best safely open up our economy and get you back to work?
And that's all the time that we have today for questions.
Thank you very much, Chrissy. We've had a couple of pretty big announcements here today, and we didn't make them lightly. Dr. Strang and I have had many discussions of allowing 2 households to come together. We know how important that is. Being isolated from your immediate family is lonely, and your mental health matters to us. So the immediate family bubble is a trial run. If we see a new spike in cases after doing this, we will have to separate you again. It's up to you to follow the protocols and make good choices. We will be counting on you to get this right, and we can do more. We want to reopen the businesses and restart our economy. Dr. Strang, though, must complete his consultations around the protocols for businesses and associations to help them understand the reopening safely. I want to tell you this is a different approach than many provinces have used. Dr. Strang and Public Health are communicating directly to business organizations and associations. It is up to those organizations to communicate with their members so everyone can figure out how to work in this new normal. They will be done soon. As part of our plan, we will be monitoring how people handle what we've announced today, including the immediate family bubble. The spotlight will be on you and on us. Your success will help us determine whether we can hit the go button in early June. We are not putting a date on this. That is our goal. It can all change depending on how well we follow the rules that have been put in place today. On this International Day of Families, I want to extend my wish to all of you to have a wonderful long weekend. Enjoy a walk on the beach, paddle around the lake, do it from a distance, of course. And if you decided to be a member of an immediate family bubble, enjoy your hug. You've waited a long time and you deserve it.